All right. Hello and welcome to our fifth week of our regional report outs here. This is the January 12th for North Central Kansas. We're glad to have you with us. We're here every week at this time at 2:30, and you can watch it live on this YouTube channel, or you can sign up at covid.ks.gov/report dash outs with an S, sorry, covid.ks.gov/report dash outs. So usually we start with the dashboard and all that, but we are fortunate to have the special advisor to the governor on the vaccine rollout with us, and he's going to give us a quick overview of the vaccine plan and where you can go to find more information. We'll put the rollout slide attached with the email and the website. But Seth, why don't you walk us through the plan? Let me make you the host so you can get all that up and going.
Perfect. Yeah, thank you, John. Well, here I just want to spend 5 minutes or so on the governor's plan that was rolled out last week for kind of vaccine and the priorities within the state of Kansas. But before we do that, I'm going to share a couple of definitions that I think are important to kind of level set on what we're talking about when we go through these phases, and that you're probably already seeing or will continue to see over the next several months as vaccine continues to roll out. So the first one is the idea of allocation or allotment. So this is simply the process of the federal level deciding based on vaccine availability, which states are going to get how much. And then we do the same thing at the state level through KDHE. And then again, this could happen at the local level. So this is happening across the board, but it's simply the process. At that point, no vaccine is actually moved or left warehouses. When we talk about that, though, that's then the next step in this process, and that's distribution. So that is getting the stuff from the federal warehouses to the state warehouse or down directly to the providers in the local communities who are then able to move on to the final stage of this kind of continuous cycle, which is the dispensing or the administering, the act of getting doses into arms. So from that allocation perspective, right now this week or very soon, it actually happens towards the end of the week, the states identified or notified as to how much vaccine they'll have available to order. They then place that order. The federal government then goes through, distributes that order, and that could be vaccine that's received next week. And then, those local providers, the health departments, the hospitals, et cetera, who are dispensing that, it could be several days before they get to that actual vaccine. So this entire process could start and take, anywhere from, 7 to 10 days, maybe even longer. So that's where we were kind of hit, or Kansas was hit a couple of weeks ago with saying that we were in the bottom state in the union for our vaccine rollouts. And as you maybe seen here recently, we're up in the middle and continuing to go up. So a lot of that was due to data lags. And so I think these definitions are definitely important to understand. I think the one other definition that you may hear and may not ring a bell are the idea of pods or points of dispensing. So this is just that physical location where you go or the communities go to receive vaccine. So again, this could also be referred to as your local vaccination clinic or vaccine clinic, your doctor's office, your pharmacy. The pod is a concept used by public health for several years now to define really more that mass vaccination, where we go to try and get a lot of people done in a very quick manner of time. So with those definitions in mind, I'm going to jump in and share the new website that was rolled out as part of the plan. And so that website is kansasvaccine.gov. Again, kansasvaccine.gov. This will be kind of your one-stop shop over the next several months for anything related to vaccine. So currently what is up there, you're able to see the total number of doses administered in the state of Kansas is at about a little over 84,000 right now. Again, this is as of yesterday, and that is actually the number of doses that were entered into the WebIZ, which is the state's immunization database. There's, again, still going to be a data delay. We're never going to be to where we have the exact number of Kansans that have been vaccinated at any one time, because there's always going to be a little bit of that delay. The rest of this website talks about vaccine safety, talks about some FAQs that you may have or that we're getting a lot of questions about. and then facts and developing or deciding facts versus fiction, and some information to help do that. But ultimately, the one question that we all want to know is where within the priorities and do we fall? So when can we get the vaccine? And then where will we be able to get that vaccine? So here on the availability tab, it'll bring up a different page. And from there, there's two pieces that I want to highlight. One being the vaccine phases by population. That is going to bring up a document that looks like this. Very, very high level, kind of tells you what phase we're in. Currently, we're in phase 1. Obviously, then the consecutive number that we would move into next would be phase 2, and who can do that. And then down here, or who can receive vaccine at that time. And then down here at the bottom, who is, or when, I'm sorry, when we anticipate moving into that. Again, this is a very high level, at a glance, does not deep dive into telling individuals where they fall. But there is a location on that website. If you go to the vaccine prioritization plan, you click on that, it's going to bring up a 10-page document that looks like this. And in the interest of time, I'm not going to go over all 10 pages, but I do want to focus just on one specific group that we'll be moving into. Obviously, 65 and older is pretty easy to define. Either you meet that definition or you don't. The other group, or one of the other groups that we're going to be servicing in phase 2, will be high contact critical workers. And so there's 3 pages or 3 pieces of every page of these phases. And so that first page, and the most important phase or part of this phase, is the definition. So again, that's the most important piece of each of these pages, is that definition. The second piece is the description and kind of information and background about how that definition was developed. And then finally, you'll see some examples of groups. So just keep in mind that these are examples. These are not all inclusive. Just because you don't see your group or a group that you identify with down here, it does not mean that you don't fit into this specific part of the phase. Really look at the definition to know if you fit into it. I'm going to pick on our retail workers before I wrap it up and turn it back over to John. So let's use, for example, in this phase, it's retail workers, but you work for a retail company doing web orders where you're at home, you're in a warehouse office, you don't have high contact. This definition clearly states you have consistent and close contact with large numbers of individuals based on your job. If you're just pushing off retail orders from a website, you're not going to meet that definition. This definition has to be met in total to be considered to be part of this particular phase. So if you don't see your definition in this phase, go to phase 3. If you don't see it in phase 3, continue down until ultimately you may be in phase 5, which will be kind of what we're considering the general public or everybody else that doesn't have a priority need. You could be somebody like myself who's middle-aged, under 65, and works from home. So again, everybody will get a vaccination. This priority level is just to help throttle how fast and to meet the availability of the vaccine as it comes out. So with that, John, I'd answer any questions you may have or any additional comments, but I'll turn it back over to you.
Yeah, Seth, thank you. I think, when you talk about examples of groups included, I think I heard Dr. Alisi, there's over 1,700 different classifications of work. So obviously it's not going to catch all of them. Anybody else have a question for Seth while we have him before he jumps off? Clarification. Seth, that's how good you are, man. That's why we love having you on.
Perfect. Well, thanks for the time today.
Doing for the state, and I'll see you at 3:45, man.
Okay.
All right. Can you make me the host before you leave?
Yes, I will.
Good catch.
I almost left. Hold on, let me make you the host.
All right. And
there you go.
Thank you very much, Seth.
Bye-bye.
Okay. I'm going to run through the dashboard here for everybody. So we go through this dashboard every week, and it is attached to the email. I've scattered down some numbers from last week compared to this week. And so when you think about this number, hospitalized, well, I'll come back here. No one reporting staffing shortages. That has become a less of a pinch point here in the last week or two, coming out of the holidays as I think people are a little healthier and there's been a little more breathing room in the hospitals. North Central Kansas, which has been generally pretty good news, it's starting to trend in the wrong direction is what I'd tell you from this dashboard. So you look, hospitalized, confirmed, or suspected COVID patients. Last week, This region was at 61. Now it's at 82. ICU beds with suspected or confirmed COVID patients was at 8. Now it's 6. This is good news here. Adult staffed ICU beds available, up from 9 last week to 13 this week. And so you're showing a 46% adult staffed ICU capacity. So that's the good news. And we're seeing this. I can tell you we've been through the 3 larger metro areas, and we're seeing manageable numbers, kind of a plateau, if you will, right now. Still on the transfer situations, taking twice as long or over 2, generally around 2.5 hours to find a bed for a COVID related patient. But here you can see our number of cases not going in the right direction for the region here had peaked here over 1,000 in the 900 regions, had started to come down into the 700s, now back up to 831 this last week, with a positivity rate, according to KDHE, of 14.4%. That was the highest of the 7 regions in the state of Kansas here in North Central. So though Seth is talking about some great things with the vaccine, I'll reiterate, not the right time to let up. So close to the proverbial finish line here this summer. It's the right kind of time to double down on our efforts. Second page of this chart always is the percentage of the population that's tested positive for each of the counties. And then the ICU bed census for the region here. So that is our North Central dashboard. And now let me turn it over to the rest of our panelists. We'll start with Carrie Ann in Public Health from Ellsworth. If you can walk us through just anything you're seeing or any color you want to add from your vantage point.
Not a lot. I'll just piggyback off of what you said with, I think we've all seen that slight increase, pinpointing it basically to the holidays. I think we're starting to finally see the effects from Christmas, New Year's. So hopefully after these next week or 2, we can start seeing our trend downwards again. Not a lot of new stuff going on. I know all the areas in our region, health departments are just working on vaccine plans and how we're going to roll that out once we get them. Just fielding a lot of those phone calls. We have a lot of anxious individuals in our community wondering when they're going to get it. So I'm just still working on testing and vaccine education. So
thank you, Carrie Ann. I'll make a point. You can add on to this if you'd like, but the state has a plan, but then they kick it to the counties, and the counties are really the ones that are going to be administering this to the majority of the population. So the counties, even inside of those subsets, may create categories of who they want to go to first based on what they're seeing in their region. So real important to listen to your county public health workers, to trust them, and to understand how that's all going to work. A lot of responsibility there, but grateful for the work. I assume, nobody I know yet across the state's ready to make announcements on the particulars there. But as far as distribution sites and a plan of action, that'll be coming from folks like yourself. Is that right, Carrie Ann?
that's correct. Like today, I just met with our local hospital. We're pretty well just teaming up to get that plan and do the prioritization for our county within the plan laid out by the governor. So, and I know a lot of the health departments are doing that, working with their public partners. I'm just figuring out how to prioritize those individuals. So I know the other thing a lot of places are working on is developing a list. So people that have started calling, I know for a while there, very few people were keeping a list. But I think we're getting enough calls now to be able to track who's interested, who's not, to kind of compare the numbers when we finally get told how many vaccines we'll get. So I think that's all just in our working with our vaccination plan. So.
Great. Thank you very much. All right, let me pass on over to Heather to give us a perspective from the hospitals. Heather?
Hi, I'm Heather Fuller. I'm the director of the Sunflower Health Network, a group of hospitals in North Central and Northwest Kansas. Just kind of want to say everybody's been very busy with the vaccine rollout. Staff is busy caring for patients, but then in addition, trying to man the vaccine clinics for staff to get that out as well, and other healthcare workers in the communities. Staff morale, we talked a little bit about last week still remains to be an issue. I think there are some communities I've heard from where the community members aren't very supportive of whether it be the masks or decisions on kind of mass gatherings and things like that. And so some of the providers are really questioning if that's where they want to be to work without that community support. So that does make it difficult, and need to kind of think of that long term and how we can support those healthcare providers, because we're going to need them now and in the future too. So I think the community can definitely help with that by wearing the mask, being supportive, doing everything we can right now. So I do want to turn it over to our two guests from Osborne County Memorial Hospital to talk a little bit about what's going on in their neck of the woods. We've got Monica Mullender, who's the director of nursing there. And then we've also got Cindy Hyde, who is the COVID team lead and also the employee health nurse there. So I'm going to turn it over to those two.
All right, I'm Monica Mullender, like she said, director of nursing. I'm going to kind of talk about the patient side of things, and then she'll talk about hers. We haven't seen the increase since Christmas and New Year's. Actually, we've seen a decrease. We only have 2 active COVID cases in our hospital right now, and very limited in the ER, which is a blessing for us right now. Our first provider tested positive and just came back today from her stint of quarantine. I've had quite a few of my nursing staff out with it. We haven't had to use travelers. We've been able to cover for each other, but the nursing staff has been hit pretty hard. Our local nursing home in town has not seen any cases yet other than a few employees, but our one located 10 miles east of us is getting hit really hard right now with, last time I talked to him yesterday, with 23 active and 5 that have passed on from it. So we've been trying to help in any way we can with that. We have been using the BAM drug and did share some of that with the nursing home patients also. Other than that,
What's the BAM drug? Can you explain that?
It's the one we give with symptoms as an outpatient. We give it over an hour, we watch for an hour, and then they go home hoping to decrease symptoms so they don't have to be hospitalized.
Is that the antibodies? Is that what?
Yes.
Yeah.
Yep.
Right.
Yep. So we actually shared some of ours with our nursing home also to try to get their patients treated. Other than that, I'll let Cindy talk.
We're pretty much done with our first and some of our second phase on our employees. We have about 46% of our employees immunized. We had some Moderna vaccine left over, so we shared that with our health department, who is ready to kind of get going with some more. We have some more essential workers that we have not got immunized in our county. So she's working on that. You know, we moved into the new hospital in March, which we think is a real blessing, because it was shortly after that things kind of started going crazy here for us. And our facility is so much more adapt for this now. We have a separate ER entrance. Our front entryway, we have a little ante room. The ER has a little ante room. We have negative airflow in the triage room. We didn't have any of that before. It would have just been really difficult. So we've been real thankful for that. There's been a lot of really good things. We've seen a few side effects from the Pfizer second round vaccine, almost worse with the second round, I would say, than the first. It'd be anything from being very tired to heart racing. We've had several that had that, several that were very tired, and a lot of muscle aches and headaches with that. Kind of the main things that we saw with it, that everybody says they would do it again. So that's a good thing.
Yep, I've been hearing that the side effects of that second shot of Pfizer are much less than getting COVID, and so people will take that versus COVID.
They will do that instead.
That's wonderful. Anything else out of Osborne you want to share with us?
You know, we have a COVID committee that consists of Cindy and I, our administrator, our
IT.
Mandy, which would be our lab. We have IT, which she also does, like our disaster. And we meet every morning for 15 minutes or so, longer if needed, just so everybody has, what today is going to bring. If we have any questions from nursing staff, I bring them, we can answer them together. We're still not allowing visitors unless end of life, and we get it approved by that committee. So that's a daily thing for us, which I think has seemed to help communication quite a bit for us.
And how do you guys feeling about morale around your team?
And my nursing team, we're starting to fill it. Right now, I don't have any out. I have an aide that will be coming back later this week. So I think being fully staffed again has really helped, but we're seeing some negative exhaustion, ready for a vacation.
Well, we're grateful for all the work that you guys are doing. Any questions for our guests or any comments, Heather or Carrie Ann, you guys would want to add to the conversation?
Just kind of want to end with saying, I agree with what Heather had said. I think that we've kind of gotten to the point where people are getting lax with a few of the guidelines that we've put out there. So really starting to stress again to our community, wearing the mask, social distance, avoiding large gatherings. We don't want to see another spike. Those are just the things that we have to do to keep us trending in the right direction. So I know everybody's tired of it. They're done with it. It's been almost a year now, but it is what it is. And those are just the things we have to do. So I know, county level, it's hard because leaders are tired of it. They are done with the mandates and just trying to convince them that we have to watch out for our healthcare system. They're the ones taking the brunt of it. And whatever we can do on our part as community members to help our, hospitals and local health partners, it's our duty. So.
And you're literally counting on these people to help with the vaccine as well. So, really important to care for these folks. And it's been interesting just psychologically to observe. It's like the calendar turned over. We got through the holidays and people were just done. And so I'm hopeful as we're kind of recentering ourselves into the new year that people can understand how close we are to the finish and find resolve in that to finish strong. That's who Kansans are. And so great message. Thank you guys for sharing that. Thanks for what you're doing. Does anybody have a bright spot that they want to share from this region? Let's see, just an act of kindness or something. So, just a couple just from not far away. How's that? Hutch Regional got some national exposure in the news for their work with the antibody treatments, certainly among the top in the state, and garnered national attention from the coronavirus task force, et cetera. And great story about what they're doing there. But one of my favorites here is our friend. I'll hold up a picture of her, Virginia Garber. Here, 101 years old, just got the vaccine this week. She's a polio survivor from when she was a kid. And just talked about, I liked her quotes in here, not reluctant at all. And I don't think the government would release the vaccine if it weren't safe. She was a former registered nurse back in Severy, back in her day, but they're talking about just the relief as this gets into some of those facilities, those long-term care facilities for folks, that they're so happy they almost want to dance. But we don't need any hips getting thrown out of place because that's a whole nother problem. Anyway, I just thought those were some great highlights out there. Still issues in the major metro hospitals, still some issues with transfers as far as those ICU beds being at a premium as people are sick. So right time to double down, monitor what's going on, and let's see if we can get those numbers down in the North Central region. So thank you all for joining us today. We really appreciate the hard work that you do and the way that you give of yourself. We'll be here this same time, 2:30 next Tuesday, to give an update, and encourage you to sign up for the email at covid.ks.gov/report-outs. And with that, we're out to here. Have a great day, everybody.